Today we're back again with another interesting topic on salivary gland problems and silendoscopy, and we have our Dr. Shantanu Tandon, Senior Consultant, ENT. Welcome, Doctor.
Hello.
Thank you for joining us.
Hi everyone.
And today we have few questions from our viewers on salivary glands and silendoscopy. And the first question would be, what are salivary glands? Like some bit.
Some basics, right? So, see, salivary glands, we would all have heard this term before, and they are just multiple glands which secrete saliva and they bring it through a small duct into our mouth. Now, largely, we have three major salivary glands: the parotid, the submandibular, and the sublingual, which is inside. But we've also got about 500 to nearly 1,000 minor salivary glands, which are all over our mouth, above our tongue, behind our tongue, and even lower down in our throat. And these salivary glands, they secrete, would you believe, up to about a liter of saliva every day. So that's a lot of water that gets recycled, and that's because it's very, very important, not just to lubricate our mouth, but it's also important because it helps us in swallowing. It has certain enzymes which helps us in digesting our food, and it also actually acts as an antibacterial. So people who don't have enough saliva, they can get frequent infections, tooth problems, etc. Because normally this works as an antibacterial and prevents any infections in the mouth.
Are salivary glands a common problem? Who are at most risk?
Okay, so largely, like any part of our body, the salivary glands can have a variety of different problems. Some of them we don't really know why they occur. For example, you can always get a tumor, you can get a cancer, you can get something called a cyst. But there are a lot of problems which can be monitored, can be avoided, and there are certain reasons why they occur. Now, to understand why they occur, you need to know that a salivary system has two parts: the gland and the duct which comes from the gland and enters our mouth and brings the saliva there. Now, in the gland, you can have, like anywhere, infections. You can have formation of tumors, which may be cancerous or non-cancerous, and you can have cysts, which are collection of fluid which gets stuck inside. Now, we don't really have a strong control over who is going to get these kind of problems. But ductal problems, problems which occur in the duct, they can occur frequently due to infections, which can be viral or bacterial. You can have stones which can form and they can block that passageway. You can have a narrowing or something called a stricture of the duct which can occur. Now, some unfortunate people who have autoimmune conditions are more likely to develop these problems. But in the general population, people who don't drink enough water, people who don't adequately eat food, who are anorexic, who don't have enough food intake, they don't stimulate enough saliva formation, and therefore they can develop something called a dry mouth. So that's something which is important. And the last thing which I think we should all keep in mind, especially people above 35, 40 years of age, that there are certain anti-allergic medicines, there are certain anti-psychiatric medicines, and there are certain BP medicines which can also cause salivary gland problems.
What are the symptoms of salivary gland problems and is it painful?
Again, you have something called inflammatory problems and something called non-inflammatory problems. So inflammation by definition will cause swelling, it will cause pain, it will cause redness. So the same happens in our glands. So patients who have inflammatory problems, something called silentinitis or an infection, they will have a swelling of the gland either here or here, and that can be extremely painful, especially the parotid gland area. It can be extremely very painful. But another thing to keep in mind is people who are constantly doing this because they feel that their mouth is extremely dry, they constantly feel the need to take sips of water. It may mean that the salivary function is not working well and they have a constant dry mouth. So pain with the swelling, with or without pain, and dry mouth are the three things that we would keep in mind.
Right. When should one should seek a medical attention of this, for this?
Okay, so we have been fortunate enough to establish a very specialized salivary gland clinic where we deal with a variety of tumor as well as non-tumor pathologies. But the gist of it is anybody who has persisting symptoms, meaning persistent swellings, persistent dry mouth, persistent discomfort in the region of the salivary glands, they should definitely get at least an opinion done, because a lot of these problems can be solved with a little bit of lifestyle modification and some mild medical treatment. But the earlier we pick it up, the easier it is to treat.
How are salivary gland problems are diagnosed?
Right. So usually understanding whether the problem is from the salivary gland is easy. Somebody just needs to do a good clinical examination and we should be able to say that this is probably related to the salivary gland. But once we start suspecting it, we want to know why this has happened. So if we are looking at somebody who has multiple salivary glands involved, then we might be thinking of a generalized medical problem. So we might get certain blood tests done to rule out something called autoimmune diseases. But when we have a single gland involved, then we will do mainly a form of imaging, either an ultrasound, which is usually the first test that we do, or when in doubt or when we want more information, we will do a CT scan or an MRI scan. There is also a highly specialized test which traditionally was done by injecting dye into the openings of our salivary glands. Now, the salivary gland of the submandibular area opens just below our tongue, and the one which is in this area called the parotid opens just behind this tooth over here. So we would actually inject a small dye into this duct, into the tube, and get an X-ray done or a CT scan done, and this is called a silogram. But with some newer advances now, we can actually do something called an MRI silogram, or this is a test wherein we can do an MRI, use a software to change the or to look at just the consistency of the fluid passing through these ducts, and therefore we, without any invasive procedure, without any injection, etc., we can get the details that a silogram would give us.
Doctor, are there any lifestyle modifications that we can do to prevent this beginning of salivary gland problems?
Yeah, so like we talked about earlier, hydration is extremely important. So if we are not drinking enough water, there's absolutely no way that our salivary glands are going to be healthy. If we're not drinking enough water, we sometimes feel our mucus dries up, our throat is dry, our nasal mucus is dry. Similarly, our saliva can start getting more and more concentrated. When it gets more and more concentrated, it causes problems. Now, one of the ways is obviously to drink more water, but to make sure that salivation is constantly stimulated, making sure you take sour items in your diet. So lemons, citrus fruits, etc. are often good stimulants for the salivary glands, and therefore that's another thing that we could do. It obviously makes sense that you don't want to smoke, because smoke is always one of the things which will harm, like all other parts of the body, the salivary system. And the last thing that we should keep in mind is anything which is dehydrating. So what are the things which dehydrate us? Caffeine, alcohol, and nicotine. So these are very, very common. And the fourth thing is any irritant in the area of the opening of the salivary glands. We do not want multiple ulcers to form and infections to occur. So these are the things that we should keep in mind as far as the diet is concerned.
Next question is, when is surgery necessary?
Okay, so nobody wants to hear the word surgery. Anybody who has a problem with the salivary glands would also be the same. They don't want to hear why should we get surgery done. But there are unfortunately some situations in which surgery will be required. Now, first and foremost, usually some kind of tumors. Now, one of the things that I didn't mention in the actual tests is something invasive, and that's a FNAC or a biopsy from the gland itself. Now, whenever we have a well-defined tumor-like lesion, we would always do an FNAC, check for the type of cells that we see, and if it looks like a tumor, especially a tumor which is gradually growing in size, we need to operate. So if it's a submandibular gland problem, you do a submandibular gland excision. If it is a parotid problem, you end up doing something called a superficial parotidectomy, or sometimes if it's going into the deeper part of the gland, something called a total parotidectomy. And if it's cancerous, then we may also end up doing something to remove the smaller lymph nodes in and around the neck along with this. Now that's primarily for tumors. But most people do not get this. The majority of problems that people get are due to duct obstructions. And earlier, the only solution used to be just drink more water, or we say, you know what, this gland is just not working, there is too much of an obstruction, we need to get it out. There are some newer procedures wherein a minimally invasive process can be chosen where we can remove the obstruction with the same.
Okay, okay. Are there any newer solutions to this salivary gland
Right.
problems?
So we just started talking about the fact that in patients who have duct obstructions, in patients who have a blockage in the tube leading to the salivary gland or coming from the salivary gland into the mouth, we now have extremely small scopes. Now these endoscopes are like very flimsy, flexible scopes, about 1.2 to 1.4 millimeters in diameter, sometimes even smaller. And we can open up the opening below the tongue or for the parotid gland, pass the small scope through it, irrigate it with water while we're looking at it, and keep on assessing not just the front part of the duct but all the way into the gland. Now, this is called cylindroscopy. And cylindroscopy now we've been using for about, well, close to about 7 years now. And we've been fortunate enough to help a lot of patients without having to make any external cuts whatsoever. This allows us to pass a camera as well as some small forceps to pull out stones. We can pass small balloons to dilate passageways. And sometimes in autoimmune conditions where there is some narrowing, we can also instill some medicines like steroids, etc., to allow the medicines to work well inside the gland without having to do any kind of a cut.
This is how is cylindroscopy more advantage?
Right. So, like I said, there are no cuts in these kind of things. But more importantly, it just decreases the morbidity over a period of time for patients. A patient who undergoes an open surgery will be in the hospital for about 3 days, will have stitches, will be coming back multiple times before the healing is complete. A cylindroscopy is something which can be done, well, it can actually be done as a day care procedure. Often we would keep them for about a day or sometimes even less. And this is one of those things which can be repeated. It is one of those things which does not have any side effects, and it's one of those things which can be used for a variety of different salivary gland problems.
The last question is, what are the potential complications if you're undiagnosed or treated of salivary gland?
Yeah. So we all know what will happen if you got a tumor or a cancer which is not picked up early. So that's not something that I need to elaborate on. If you've got a tumor, do not spend too much time thinking about it. At least get yourself assessed. Okay. But what people don't realize is that if you've got a history, and this is a very classical history that a lot of people get, that once in a while, after having a food, especially some sour food, the swelling of the submandibular gland or the parotid gland happens. It stays for about half an hour or an hour or 2 hours, and then it gradually becomes normal. Now, when this happens, we know that there is something which is blocking the passageway, which is bringing the saliva, because that's the only reason why this kind of a problem will happen. But if this keeps on happening again and again and again, then what will happen? That whole area becomes infected multiple times. That area then can develop scar tissue, and because of that, the tube can get permanently blocked. Now, once we reach that kind of a situation, then the only solution is to do an open surgery. We can avoid all this and prevent any kind of surgical intervention if we are able to pick these things up early, and therefore it's always a good idea to screen yourselves whenever in doubt.
Okay, doctor. Thank you so much, doctor, for your valuable insights. And to all the viewers, to book an appointment with our Dr. Shantanu Tandon, you can log into sakarahospital.com, or you can just click on the post description link where you can log in and book your appointments with our doctor. And keep following us in all the platforms, and we keep you updated with all the health tips. Thank you.
Right. Bye bye.